you interested in a new career path? Well, if so, ask yourself if guinea pigging is right for you. My name is Brian. I've been in the health and wellness world for close to 20 years, and I've been coaching pro-metabolic health for nearly 10. Today, we're going to talk about the blooming career path of professional guinea pigging. What is professional guinea pigging? When you have a drug, as a drug company, you have a 20-year patent on that drug from the time it's patented to the time that patent expires, and other companies can now do whatever they want with it. In that realm, it is of the utmost urgency for that pharmaceutical company to expedite the drug testing process. In order to expedite this process to get from phase 1 to phase 2 to phase 3 clinical trials to get approval for safety and get that drug out into the market, there are companies whose job is to design and run through these tests. These are known as contract research organizations, or CROs. What a contract research organization does is they get hired by pharmaceutical companies to set up design and go through the entire FDA approval process, all the paperwork, all the bureaucracy, and not the least of which in those responsibilities is the recruitment of trial participants. There are private labs that will actually seek out and hire people to participate in the drug testing studies. And it's not always drugs. It will sometimes be how do we test a certain new medical procedure? How do we test certain types of actual analytical testing itself? We'll do biopsies of tissues and then compare that with our testing methods. So there's lots of things that will go into designing and setting up these trials. And there are companies that will do that on a contract basis for these bigger pharmaceutical companies. And it's in the best interest of these private contract research organizations to do two things: to urgently recruit people, to start the trial as fast as possible, and secondly, to design the trial in a way that shows a favorable outcome for the pharmaceutical company. See, the pharmaceutical company doesn't necessarily invest in the patent process and the testing process if they don't intend to make their money back later on. But if that contract research organization says, this drug, this procedure, this process, this whatever we're testing is not safe, the likelihood of that company being hired again for future testing goes down. Because they're a private lab, they're not they're not necessarily working with Pfizer for the sake of Pfizer designed and set up that lab. They're working for themselves, and they have contracts with these bigger companies that need their services. So as a private lab, it is in their best interest to provide a favorable outcome for the interested parties. That's another conversation for another time. We're going to talk about the people that they recruit today. So if you're interested, you can make anywhere from $1,500 to $3,000 in a week's time, testing various types of procedures, testing various new types of treatments, various drugs that are on the market. And all of that will influence your physiology. That's right. So you're testing something, you're signing away your rights and waivers of liability, and you're basically signing up to be exposed to random chemical compounds or procedures that may or may not have lasting effects. Some people in 2001, I think it was, maybe sooner, maybe later, I don't know the date for sure, don't quote me on that, they were testing monoclonal antibodies for MS treatments and rheumatoid arthritis. And what they found was that there was a major side effect outburst of that, and some of the participants actually lost their fingers. Some of them had lifelong alterations to their body because of emergency procedures to it, or resultant from that. So sometimes these tests aren't necessarily safe. And furthermore, you'll get people that becomes their career to test these things. And if you want to make money doing that, as a guinea pig, a professional guinea pigger, it is in your best interest to lie about the side effects you might be experiencing from previous trials. So if you take a drug and you have an experimental drug and you have an adverse reaction to that, but you want to make more money on the next trial you sign up for, you might not admit to having this weird reaction because that might preclude you from getting recruited for the next trial. So in that case, it is oftentimes in the best interest of the guinea pigger to not disclose certain bits of information about their health, about the reaction to that treatment, the reaction to that drug. And oftentimes what will happen, if you drop out of these trials on your own volition, you will not get paid. They will not pay you if you say, you know what, I'm done, halfway through, I'm out. But if you report a side effect of, oh, well, I was fainting on the job, they'll still pay you usually. But oftentimes, the CRO will try to convince you to drop out of your own volition, as opposed to reporting the side effect, A, because it changes the data set, and B, because they don't got to pay you. So when it comes to the continuity of these trials, when it comes to the people that are sticking with it, there's a lot of shady backstory that goes into how safe some of these procedures and treatments are. And it's just worth knowing that. It's just worth having that in the back of your head. Because every time you hear somebody say, oh, well, it's safe. Oh, it's gone through all these safety mechanisms and safety procedures, just know that sometimes the way that those companies, the way that those organizations set things up, it is not in the best interest of safety. It is in the best interest of limiting liability. Hopefully you enjoyed this. Hopefully you're not necessarily considering a career in guinea pigging. If you are already doing guinea pigging, it might be worth looking at alternatives, because sometimes you can have weird reactions to things that can last a lifetime and you may not know it yet. You may even be suffering with some of those reactions still to this day. So hopefully you found that interesting. Hopefully this gave you something to ponder and think about in the world of evidence-based medicine. But from that standpoint, stick around. I got more videos like this to come. Like this video, share this video. I will see you later. Take care.